Hi, Dr. Baumholtz. This is part 2 of a video where I'm going to show how I use the VECTRA technology. VECTRA is a device we have here in the office, that's this, to demonstrate an augmentation mastopexy. Now this is a computer simulated image of a patient. It's not a real patient. And what I've done thus far is here on the left, this was the original image, and I've already performed, on the computer at least, the lift portion to give this person an idea of what a lift alone. Now, if someone said, I like the position, the more youthful position of my breast, but I miss the volume I had, the next thing is we're going to talk about putting an implant in, and I'm going to demonstrate how the system does that right now. So let's go put in some implants, and we're going to pick some moderate profile silicone implants just to give an idea of how things might look. And one of the benefits of this particular program versus the old-fashioned way of stuffing implants into a brassiere or putting on falsies is, generally speaking, we have decreased the number of patients who came back and said, I didn't go big enough, to almost none. One of the more common complaints in the prior generation of plastic surgeons who spoke with patients, the patient would come back and say, geez, I wish I had gone bigger. We don't see that often with this system. Now here we have on the left the original patient. Here we have a lift with the implant. I can take it a step further and I can demonstrate that we can show here is the original situation, here is lift only, and then here is lift with the implant. I can show this a couple of different directions, a couple of different ways. I'll turn to the side, and this is one of the more powerful features of the program, is I can show here's the original patient and this is what things would look like or might look like with a lift and that implant. Now, if I'm just showing an implant alone, I'd say the program's about 90–95% accurate. If I have to show a lift with an implant, I'd say it probably gets to be about 85–90% accurate. There are some variabilities, and we'll talk about that when we meet in person. It is still, I think, the best way that I have to communicate with the patient what things might look like and to try to get at what they're looking for, the look that they're trying to achieve. Well, that's a brief overview of how we use VECTRA, and I'd like to visit with you in person. If you've got questions, please call us at 210-920-2390. I'm Dr. Baumholtz. I am a board-certified plastic surgeon. I look forward to meeting with you. Thanks so much.